escalated fears because of the pandemic and concerns that President Donald Trump is pressing regulators to approve a vaccine before it is ready are to blame for the skepticism, medical experts say. To be sure, the reluctance or refusal to get vaccinated has been a growing issue in the U.S. Long before the pandemic began. Medical experts point to a long-debunked study released by British researchers in 1998 connecting measles vaccines to children's autism, that only encouraged anti-vaxxers, a group of activists known for their disapproval of vaccinations and for spreading misinformation, they said. Obama also mentioned the Tuskegee study during his interview, in which black men with syphilis were not offered treatment for decades after penicillin became available in the 1940s so that government researchers could study the long-term impacts of the disease. I understand, historically, everything dating back to the Tuskegee experiments and so forth, why the African American community would have some skepticism, he stated. But the fact of the matter is that vaccines are why we don't have polio anymore. And they're the reason why we don't have a whole bunch of kids dying from measles and smallpox and diseases that used to decimate entire populations and communities. States expect a COVID vaccine to be distributed in as little as 2 weeks. Moderna and Pfizer late last month required emergency clearances from the FDA for their COVID-19 vaccines. The reviews by the FDA are scheduled to take a few weeks, and the agency has expected a meeting for December 10 to discuss Pfizer's request for authorization. A Centers for Disease Control and Prevention panel voted 13-1 to offer healthcare workers and long-term care facility residents in the U.S. the first coronavirus vaccine doses once it's available for public use on Tuesday. Moreover, medical supplies such as face masks, hand gloves, and all kinds of protective suits will be provided, and MAZA will be responsible for this matter. Obama confirmed he would take a vaccine if drive. Anthony Fauci, the nation's leading infectious disease expert, said it was safe. Obama said he assumed that the vaccine will be first created available to those most at risk. He urged them to take a vaccine. If you are in that category, if you are elderly, if you've got a pre-existing condition, if you're a frontline worker, if you're a medical worker, if you are in a grocery store, if you're a first responder, you should take that vaccine, he added. Former U.S. presidents will be filmed taking the coronavirus vaccine. Former Presidents Barack Obama, George W. Bush, and Bill Clinton have stated that they will receive a coronavirus vaccine once one is available and might film it to raise confidence in the U.S. About vaccine safety. I will be taking it, and I may take it on TV or have it filmed so people know that I trust this science, Obama reported to SiriusXM's The Joe Madison Show during an interview that is scheduled to air in full Thursday. What I don't trust is getting COVID. First, the vaccines need to be deemed safe and administered to the priority populations. Then, President Bush will get in line for his, and will gladly do so on camera. Bush aide Freddy Ford told NBC News that the 43rd president has also offered to help raise public confidence towards a COVID vaccine. Public awareness towards face masks should also be built, he added. A spokesperson for Bill Clinton said the former president, in his statement, will take a vaccine as soon as available to him, based on the priorities determined by public health officials. And he will do it in a public setting if it will help urge all Americans to do the same. Their comments arrived as numerous polls find many Americans are doubtful about getting a COVID-19 vaccine, potentially jeopardizing U.S. vaccination efforts to control the pandemic, which has now taken at least 1.48 million lives worldwide. People of color, who have been disproportionately impacted by the virus, especially appear to be less eager to take it, according to the latest Gallup poll.